POTS has become one of the most common reasons that people are coming to see us because they are having dizziness. So I thought it would be helpful to understand why a POTS patient can feel dizzy, and that way it opens up ideas on how we can manage patients with POTS in order to help them feel better. In order to understand POTS, it's helpful to understand what happens to the body when someone goes from laying down or sitting all the way up to standing. In a normal situation, when we go from sitting to standing, there's about 500 milliliters of blood that is going to go down and pool into our legs and our lower extremity when we go from a seated to a standing position. This is if the body just lets gravity do its work. So the force of gravity is going to pull all that blood flow down towards the feet and ankles, which means there's going to be a little bit of a deficit in the blood that is trying to get up to the brain. This deficit in blood flow getting to the brain is called hypoperfusion. And when people have hypoperfusion, it also means that they're going to have less oxygen getting into the brain, which a lot of people are going to feel as lightheadedness, but it also is going to affect the brain in many different ways, leading to decreased functionality of the brain as a whole. Now, this is what happens if gravity runs unopposed. Fortunately for most people, we have a lot of mechanisms that actually prevent this from happening. In a normal situation, we have these structures called baroreceptors inside of our carotid artery and inside of our aortic arch. And these baroreceptors are going to detect when there's less pressure getting into the arterial system. These baroreceptors fire into the brainstem, which activate the sympathetic nervous system. So the sympathetic nervous system is going to cause our blood vessels to constrict, meaning it's going to increase our blood pressure. It's also going to send signals into the heart to probably beat a little bit faster. On top of that, whenever we make the decision to go from sitting to standing, our brain should already send signals down to our leg muscles to start to contract before we actually get into the standing process. So it should be preparing our body to go into standing by contracting some of those muscles, so it forces some of that deoxygenated blood back into the heart. So all these different places are where this could break down. So our baroreceptors might get attacked by different autoantibodies, which considers POTS like an autoimmune disease. We could have small fiber neuropathy, making the muscles and the joints in our lower legs less effective. We could have connective tissue disorders, which means our blood vessels might not be able to have the supporting tissue in order to keep our veins and our arteries moving blood along in a smooth manner. But in this article written by a leading POTS clinician out of Buffalo is actually making a case that POTS may actually be part of a central nervous system disorder, which is something that a lot of functional neurologists would agree with. She makes the case that there can be neuroinflammatory and neuroplastic reasons why patients can develop problems in their ability to regulate blood pressure and heart rate that can lead to the manifestation of that hypoperfusion in POTS. Which, if it is central, then it allows us to use targets like the cervical spine vestibular system and areas of the brainstem for neuromodulation as potentially effective ways to manage patients with POTS.